Hi everyone, my name is Mike Lang and I'm an alumni of the Faculty of Nursing at the University of Calgary, and I'm really excited to be one of the coaches for the Story Slam that you are obviously interested in if you're watching this video. One of the things that I get to do is work with patients and families as well as healthcare providers to create important stories from their lives that then we can use in different quality improvement initiatives around the healthcare system. And so I've been able to work with hundreds of healthcare providers to create these things called digital stories. Basically, they're just short little 3-minute movies about their lives. And in that process, I've learned a lot about how to find and tell meaningful stories from just everyday routine clinical practice. And I wanted to share just a couple ideas with you guys in case you're wondering if you have a story that's worth sharing. Because one of the things I've found with most of the healthcare providers I sit down with is they think, well, this is just what I do every day. I don't know if there's any stories here, and there always is. So couple ideas to think about, maybe to get the creative juices flowing to help you with writing your story for the Story Slam. So first of all, when I work with people, I usually ask them this question to start. What was one of the most meaningful moments for you related to your work? Right. And so often there's a topic area involved. But what we're doing with that question is looking for these meaningful moments around sort of either the mundane clinical practice or some of the big exciting moments of clinical practice, really because it's in the most meaningful moments that there's often pieces of wisdom that is there for us to draw out and for others to learn from. And so think to yourself, what was a really meaningful moment for me in the past week, month, year, whatever. Where's something that I remember when I think about the most meaningful moments of my work? What immediately bubbles up to the surface? So that'd be question number one. That's a good place to start. Question number two is to ask yourself, why? Why was that so meaningful to me? Often, we don't stop to reflect on these experiences. We just know that they were important. We don't know exactly why they were important. And so that's what's a really great second step, is to ask yourself why. Because in that answering that question, why was that important? Why did it matter when that person said that to me? Why did it matter that I had to go hide in that storage closet for a few minutes? Why did it matter when I got that thank you letter from that patient? Why do those things matter? It's in those questions that we find out the nuggets of wisdom that we have to offer each other. So that would be the next one. The final question would be, what do people need to know about you to understand that meaningful moment, right? And this is basically the rest of the story, right? Is in order for people to understand why it was so meaningful for you to have to go and hide in that supply closet for 10 minutes, then they won't understand why it mattered, right? Because people go in and out of supply closets every day. So why did it matter that you having to go hide in there was a big deal, right? What was the meaning behind that? So anyways, I just wanted to give you guys just some ideas. So ask yourself, what were the most meaningful moments? Ask yourself why they were meaningful, and then ask yourself, what information do people need to know about me to understand those meaningful moments? And there you've got sort of a framework, a base of to start writing the story in a very creative way. Last couple things I'll share with you. Try and you've all heard the thing, show don't tell. That's what storytelling is all about. So just tell the story in a way that people learn your message or your idea through the story that you share. So don't just share it directly to people. Leave some room for interpretation. That's one of the best things about a good story that's well told, is everyone will find something else in it that you maybe weren't expecting. So that would be one thing. The second thing is to try and actually tell a story. In healthcare, we like to tell things called technical accounts, right? This happened, then this happened, then this happened, then this happened. And we forget that stories are all about not just what happened, but what we thought and felt about what happened. The context around what happened, the inner emotional experience of those activities that happened, right? That's the type of stuff that really makes a compelling story. It's just going beyond the surface level. This happened, this happened, this happened. So the final thing I'll share is think about the conflict in your story, because without conflict, there is no story. So just keep that in the back of your mind. Sometimes we like to sort of push away the conflicts in our healthcare practice. But really, it's those conflicts that actually cause movement in our story and in our life. And so we need to lean into those things, especially when we're trying to tell stories that are meaningful and have wisdom embedded in them. There's three big types of conflicts in good stories, and all good stories will hit on all three layers. There's external conflicts, there's internal conflicts, and then there's philosophical conflicts. And so I'm not going to describe those for you. We're going to do a bit more of that on the coaching day. Hopefully that gives you a place to start. The last thing I'll share with you guys is that you do have a story. You've got great stories, many great stories that have something to offer other nurses, other healthcare practitioners. And I'm really excited to hear more about those. And I can't wait for the Story Slam to get to meet you all. Good luck as you sort of write the rough drafts of your stories. And I'll see you later. Bye.